Hi everyone. We are going to discuss chapter one on public health nursing. So the objectives for this chapter state the mission and core functions of public health, describe specializations in public health nursing and community health nursing and the goals, contrast clinical community health nursing versus population-focused practice, and then describe what is meant by community and prevention-oriented population-focused practice. Barriers to acceptance of community and prevention-oriented population-focused practice, and then state key opportunities for community and prevention-oriented practice. All right, so there's been renewed interest in public health and in population-focused healthcare in the United States. So part of that has been with the Affordable Care Act, and then, we have the Healthy People. There's 2010, 2020, they're working on 2030. And we have National Prevention, Health Promotion, and Public Health Council, Prevention and Public Health Fund, Improvements in Prevention, so the U.S. Preventative Services Task Force, and that is kind of brings together all the recommendations for health promotion and disease prevention. So that's when you hear about, how often you should get a mammogram, how often you should get pap smears, when you start colon cancer screenings. And so we're looking at things with a population-focused approach. So, and it's not just population in terms of the entire population of the United States. It's broken down into different populations. Those at risk for heart disease. A population can be the Latino population. A population can be children. A population can be the elderly. And it's an emphasis on prevention. And there's different levels of prevention, which we're going to discuss. It's really important for you to understand the difference. So there's a new need for public health nursing. With the way healthcare has changed, having more and more nurses out there working in public health is just as important as it is to have nurses working in the acute care setting. Prevention and health promotion is super important because we are living longer, people have more access to healthcare, and we want to keep our population as healthy as possible because in the end, we have a more productive society and we have a more cost-efficient society. So this is a time of opportunity and challenge. There's lots of growing costs. The U.S. Demography is changing. There's lots of people immigrating here. We have lots of people seeking asylum and refugee. And then we're concerned with bioterrorism, violent terrorism in general. And then there's epidemic prevention. So we saw how Ebola almost became an epidemic in the United States, and we saw how quickly it spread through Africa and parts of Europe. We had the Zika scare, and that was an epidemic in parts of South Florida. And it was a really scary time for people. So that all is part of public health nursing. So it's the foundation for a healthy population. There's a solid history of preventative improvements, and you can see, public health practice was how nursing started. Florence Nightingale went out there and started seeing in the war that post-operative soldiers died from infection, not from their initial wounds, and that was the first, kind of documented nursing epidemiologic study. And then in the Institute of Medicine report in 2012, there was an emphasis on funding public health services, so making mammograms accessible because it will save people and people's lives and money over time, and then emphasis on population-based prevention. So looking at risks and seeing who it affects and pulling that population and finding ways best to implement prevention to promote health. So the Affordable Care Act, it has potential benefits for the public health nursing. It gets more people insured, so we can bring more people toward prevention and promotion. If you don't have insurance, then you don't get seen until it's an emergency. And an emergency, by its definition, means we're past the point of prevention. Public health agencies now can shift to direct clinical service, and public health agencies could refocus on community population and focus promotion and prevention. All right, so more people had access to health insurance and thus health care, we could refocus on community population promotion and prevention instead of this acute reactive um, response to health. So the more people who have health insurance, the more prevention and health promotion we can have. So when you talk about public health in America, we have a vision: healthy people and healthy communities. Our mission is to promote physical and mental health, prevent disease, injury, and disability. So that's important too. Occupational health nursing, that's an area of community health that's really important. We want to prevent disability. We want to prevent low back pain. We want to prevent depression, which are the two main causes of disability in this country. So assessment of population, developing policy, and then providing assurance. Those are essential public health services. So public health has core functions. We talked about that: assessment, policy development, and assurance. So on the bottom, we give population-based healthcare services. There's clinical preventative services, primary healthcare, and then you go to the next steps, which is secondary healthcare and tertiary healthcare, which is acute response. So really quick recall: one goal of public health nursing is to focus on A, tertiary healthcare, B, primary healthcare, C, population-based services, or D, clinical preventative service. What do you guys think? So population-based service, right? Because we focus more on the population, promoting health and disease prevention for the greater population. So core competencies: you need to be able to understand how to assess and analyze information, to look at lots of data and see where trends are going, who's at risk for what. Policy development and program planning. One program that works in your community might not work in mine. What policies out there are barriers? What policies out there are helpful? What are modes of communication? How do we communicate? How do we approach problems? How do we approach policymakers? Cultural competency. So it's not just culture in terms of ethnicity and race, right? There's population cultures. I live in Cincinnati, Ohio, and there's definitely this cultural ideals between East Side and West Side, and how to approach that. Community dimensions of practice. So what makes up the community? Who do they depend on? What are they proud of? What do they struggle with? Basic public health science, financial planning and management, and then leadership and systems thinking. Here are the 3 tiers. All right, so quality improvements in public health. We're looking at curriculum, performance standards, and accreditation processes. So the competencies for the curriculum: we look at informatics, how to use data; genomics, so really looking into health histories and genetics to assess risk; cultural competence; community-based participatory research, so Google community-based studies. There's going to be a lot of information; policy, law, global health, and ethics. So which categories of curriculum content are missing from this list? So you see informatics, genomics, community-based participatory research, policy, law, ethics. So what else is missing here? Cultural competence and global health. So the 4 principles of National Public Health Performance Standard Program. So it's developed around the 10 essential public health services, and you focus on overall public health system rather than a single organization. And it describes an optimal level performance and supports a process of quality improvement. So the practice of promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences. That is the definition of a public health nurse. So I'll repeat it again. The practice of promoting and protecting the health of populations using knowledge from nursing, social, and public health sciences. So the public health nurse specialty: your population and community oriented, health and preventative focused. Interventions are made at the community or population level. So it's not individual. You're not looking at the individual client. You're looking at the community or the population. And you're concerned for the health of all members of the population community, particularly those in the vulnerable vulnerable subpopulations. Here are the essentials that we talked about. Here are the different education paths. So population-focused practice, population or aggregate, meaning a group of people. It's a collection of individuals who have one or more personal or environmental characteristics in common. So that characteristic could be geography. It could be a special interest like miners or motorcycle riders, or circumstance like poverty or orphans. Subpopulations are groups within a larger population. So subpopulation of school teachers or public school teachers, right? A subpopulation of African American or African American women. So it's a smaller group within a large group. So population focused versus the individual. We're all used to the individual, right? We diagnose, intervention, and treatments are carried out to the person. But population focused is all those diagnoses, interventions, and treatments are done toward the population or subpopulation. So, when we're talking about women ages 21 to 65, that population, pap smears, that's our level of prevention for cancer, cervical cancer, right? But when you have a 21-year-old female who has multiple sex partners and smokes, then your level of prevention, your preventative interventions are going to go beyond just encouraging the pap smear, right? You're going to talk to them about their sexual history, about their smoking, maybe if they're obese. Population level decision making is different, and it's concerned with more than one subpopulation. So here's a little diagram of that. Levels of healthcare practice: community level, population, and individual or family.